I'm sorry. We did everything we could, but at 10 minutes past 3 this morning, your daughter, she passed away. I'm sorry. My sincere condolences. 59. As medical doctors, we don't forget the number of people we have had to certify dead. My number is 59. That number sticks at the back of your head as if it were imprinted with a permanent marker, as if marking you every single day of your life. 59. Keep these images at the back of your mind. We will revisit them in about 10 minutes. My name is Esperance Luvindao. I am a medical doctor. I am an international health advocate, and when I am not taking care of the sick, I'm traveling around the world speaking. But the most important thing for me is I am a visionary, and I have a vision for the African healthcare system. Very simple. No fancy English. Healing. That is my vision for the African healthcare system. And the only way we will be able to achieve that is, number one, understanding that change is inevitable. Whether you want it or not, change is coming. It has already started. Technology has proven it. And unfortunately, Africa is far behind. Secondly, is to understand that change is possible. Because for so many of us, it has been inculcated into our minds that Africa must always be behind. So to understand that change is possible. Third is to understand that we will need to find the root causes. So what is the problem? And then when you find the problem, it is to be honest about what can our solutions be. Healthcare is not a basic human right. I repeat, healthcare is not a basic human right. Now, when I said this for the very first time, I was at a healthcare event, and I had the audience of the President of the Republic of Namibia, the First Lady of the Republic of Namibia, the Minister of Health, and a few other dignitaries. And I remember the look on their faces because the national television stations were there, and they were probably wondering, oh my goodness, what is this young woman going to say next? But I stand on my point. Healthcare is not a basic human right. We'll come back to that. In the year 1996, someone from Japan created this. Now, for many of you, if you share any sort of similarities with my childhood, you will know that this is called the tamagotchi. Now, the tamagotchi was the highlight of my childhood because it was a handheld pet that you had to take care of. And this pet would tell you when it was sick, when it was hungry, and if you didn't manage to take care of it, it would die. Now, a couple of years later, people started referring to these phones as tamagotchis. Probably because unlike the cell phones we have today, it can't do much. So it can't update a status on Twitter, it can't go on Instagram, it can't post a reel, it can't do any of those things, and because of that, they call it a tamagotchi. And so for the purposes of my talk, I am going to refer to this as a tamagotchi, and how we can break the barrier of healthcare in Africa using a tamagotchi. When we talk about healthcare, the biggest problem we face today, now this is not just in Africa, so it doesn't matter where you come from, all over the world, the biggest problem is accessibility. In the year 2020, a study proved that less than 50% of Africans have access to healthcare. Less than 50%. In the same year, another study showed that every single year, 15% of Africans are pushed into poverty because of unexpected health costs. So when we talk about accessibility to healthcare, we're talking about three basic things. So number one, are there doctors available? Because that's the biggest problem we're facing today, shortages of doctors. And then the second thing is, even if there are doctors available, can you access these doctors? Because it doesn't matter, you have Esperance that works in Windhoek. If you are in the rural area in Namibia, her being a medical doctor doesn't help you much. And then the third thing is access to healthcare information. So are you able to access healthcare information in a timely manner? In the year 2020, now COVID revealed a lot. February versus April 2020, the number of people that make use of telehealth shot up 75 times. Pre-COVID, post-COVID, after COVID, 40% of people surveyed said that they intended on using telehealth. Before COVID, that number stood at 11%. So whether we like it or not, technology is taking over. Healthcare is not exempt from that. And the sad part is, mentally, we have convinced ourselves that Africa lagging behind is normal. And it is a given. So let's get to the crux of the matter, shall we? Healthcare does not need to be expensive, and no, you do not need to be rich in order to access good healthcare. What do I mean by that? Firstly, you don't need the internet to see your doctor. Neither does your patient need the internet to see you as a medical doctor. Let me break it down. What is a consultation? A consultation is when a patient comes to me and says, "Hi doc, I have had a vaginal discharge for the past 7 days," and I would proceed to complete that consultation by saying, "What color is it? Does it smell bad? Are you itching? When last did you have sex? Did you use protection? Are you allergic to any medication?" And then proceed to say, "Well, it is possible that you have developed a sexually transmitted disease. I would need to treat you with the following antibiotics, but please make sure that the next time you have sex, that you use protection." Okay? That is a consultation. That is telemedicine. And that does not need the internet. Secondly, what if I told you that by using a tamagotchi and USSD codes, we could break the barrier between patients and their doctors? Right? Because all you really need as a patient to be able to access the relevant information in a timely manner. So, what if you could use this phone and dial *130 or *160 and then gain access to a list of healthcare conditions: HIV, diabetes, sexually transmitted infections, heart failure. And then when you click on that, you would then be given a list of options. For example, if you have HIV and you're worried that you may be suffering a side effect from one of your medications because you've noticed an uncommon skin rash on your body and you consulted Dr. Google that told you it might be Steven Johnson, you would then be able to click on HIV, click on ARV, click on the necessary side effects, possible side effects, be given a list of side effects, and then, if that information was not sufficient, you would then be able to, using the same tamagotchi, have a communication and contact with your doctor, wherever they are, who would then be able to say, most likely this is Steven Johnson, you would need to stop this drug and start this drug. And these are the healthcare centers that are available nearby you, that you can access, that have the correct drug in store. That is telemedicine. That does not need the internet. That needs a tamagotchi. What if I told you that in an emergency setting, a patient in the rural area with their father having a myocardial infarction, which is a heart attack, would be able to see them having a heart attack, dial the code *350, for example, which would then send an emergency signal to the nearest healthcare facility, which would know that there is an emergency happening and dispatch an ambulance immediately. This does not need the internet. This needs a tamagotchi. And then, after dialing that code, the alert is given to the necessary clinic. You would then be prompted to ask what is going on. Is it chest pain? And after a list of questions, you would then be able to say, they would say, maybe this is a myocardial infarction. Do you have aspirin in your house? If you do, please give it to the patient while you wait for the ambulance. That is telemedicine that does not need the internet. Now, telemedicine has advanced because technology has advanced. So when we talk about the third one, which is accessibility to healthcare information, it doesn't mean you have to be a doctor. And I say it all the time. We don't expect you to be a doctor. We don't expect you to be a nurse. But we do expect you to know the basics about your healthcare so that you can take control. But the problem is, a lot of people don't know the basics. So, what if I told you that by using a tamagotchi and USSD codes, we could provide health education in the form of 2 text messages every single month to people living in rural areas, Namibia, South Africa, Nigeria, Zimbabwe, you name it, that would say, for example, did you know that you have to get your pap smear done every 3 years? And if there's a problem, you need to do it every year. Or, did you know that there are contraceptive options that can last for 3 to 5 years that your doctor puts in your upper arm that you don't need to take a pill every single day? Or, did you know that there's a contraceptive option available that your doctor puts into your uterus that lasts up to 5 years, one of which doesn't have any hormones at all? That is health education. That is telemedicine. That does not need the internet. That needs a tamagotchi. In the year 2001, the regulating health bodies started the process to approve capsule endoscopies. Capsule endoscopies meant that, as opposed to what happens today, where your doctor will say the bloods show nothing, the x-rays show nothing, and now I need to put a big, big tube through your mouth or through the other end in order for me to see what is happening from your mouth to the other end. Very uncomfortable, requires you to go into the hospital. But technology has now advanced to a point whereby you, sitting at home in rural South Africa, can swallow a simple pill, and your doctor, sitting in the United States of America, can see what is happening from your mouth all the way to the other end, using one pill. Every single year, 1 million teenagers fall pregnant. Every single year. 15% of young women that fall pregnant are below the age of 18. Do they want to fall pregnant? Probably not. In the year 2019, I conducted a delivery, a C-section, of my youngest patient ever, and she was 13 years old. I was emotional. I had to hold back the tears. Her pelvis was so tiny, it just didn't seem right. I completed the process. We sutured her back up. And I remember I quickly went to the nurse's station and I shed a tear or two. And I had a conversation with my colleagues and I said, what are we doing wrong? Because clearly we are doing something terribly wrong. Because we sit in our offices, our air-conditioned consultation rooms, and we say that we are medical doctors, yet 13-year-olds are giving birth. What is the problem? Do you think they want to fall pregnant? Probably not. Health education is key. But for a lot of the population all around the world, this is not happening. So, what if I told you that by using tamagotchis and USSD codes, we could educate these teenagers and drop the number of teenage pregnancies from 1 million to less than half in 1 year? Sounds impossible? No. Because when on contraceptives, your chance of falling pregnant usually less than 1%. So it is possible. Every single year, 800,000 children die of dehydration, usually from vomiting and diarrhea. To you, sounds so basic. You make that thing the doctors talk about, the water, that thing. But for a lot of people in the rural areas, they don't know that thing. They don't know that by mixing water, 1 liter, 8 teaspoons of sugar and 1 tablespoon of salt, you could save your child's life. And majority of the times, they bring in their children from simple vomiting and diarrhea at the point of death. What if I told you that by using telemedicine, a simple tamagotchi, and USSD codes, we could go from this, and this, and this, to this. Telemedicine is advancing, technology is advancing. So, 59. That is my number. For another doctor, 1,000. For another, 200. For another, 500. The point is, if we are open enough as Africans to say the change is coming, whether we want it or not, and if we are open enough to say that there does not need to be such a big difference between those in the rural areas and the urban areas, if only we are open enough to allow telemedicine to take its roots, we can heal the African healthcare system. So, healthcare is not a basic human right. I repeat, healthcare is not a basic human right. Quality healthcare is a basic human right. Thank you.